Hi there.
Hi.
I'm Dr. Michael Morrow. I'm one of the radiologists here. How are you?
I'm okay.
Is this Colin?
Yeah.
Okay. And you're Colin's mother?
Yes.
Okay. So, I understand he's been having abdominal pain, and the emergency physicians ordered an ultrasound scan, which we performed, and I'm here to give you those results.
Okay.
So what we found is we were able to see his appendix, and it looks inflamed, enlarged, and so we can see that with acute appendicitis sometimes.
Okay.
Does that make sense? Do you understand?
No.
Okay. So I think that's one of the reasons that the emergency physicians ordered the test, was to look for acute appendicitis.
Okay.
And so basically what that means is it's when the appendix, if for various reasons, becomes enlarged, is swollen. Sometimes it's caused from a little obstruction of the appendix. The appendix, do you understand what the appendix is even?
No, I've heard of it.
Yeah, I think.
No, I've heard of appendicitis, but I don't know.
Yeah, so it's part of your gastrointestinal tract.
Okay.
It's a little tube basically
Okay.
that comes off of your bowels.
Okay.
And it can become obstructed sometimes for whatever reason. I can't see why, but all I can see is that the appendix is big, it's inflamed, and it's probably causing his abdominal pain.
Okay.
It's because it's usually here in the right lower abdomen, and it sounds like that's where he's having pain.
Yeah.
So that's what. Does that make sense?
Yeah.
Do you understand that a little bit better now?
Yeah, a little bit. Yeah.
Okay. And what's your understanding of did they talk to you at all about what might happen from there, or?
No, they
Okay.
had told me that he was most likely constipated and we could go home. So I mean, this is all
Oh wow.
new to me. I'm a little, I guess, confused because they said, he's just constipated. We're gonna get an ultrasound and then you can take him home.
Okay.
So I guess I've been a little thrown, I guess.
Yeah, that's very different kind of.
Yeah.
Not constipated.
Yeah.
So.
Yeah, no, not constipated.
I can imagine that that's a little bit off from what you were envisioning.
Yeah, I was thinking we're gonna get dressed. I was just talking to him. We're gonna go home. Don't worry about it.
Okay. What questions do you have about that? I mean, I know that if that's not what you're expecting, I want to make sure that I've understand what you.
So no, that was just all we knew, I guess. So what does it mean, when he has appendicitis? What's the treatment for that?
Well, I'm involved on the imaging side of things.
Okay.
I can give you a little bit of information. I don't want to give you any kind of false information at the same time.
Yeah,
so
of course.
So the main thing is they will probably call pediatric surgery.
Okay.
Okay. So many times patients with appendicitis or acute appendicitis will have to have their appendix out.
Okay.
Taken out surgically. So it might entail surgery.
Okay.
That's not always the case, and it just depends. And once again, that's not my call to make.
Right.
Like I said, once we're done speaking, they're gonna take Colin back to the emergency room, and then you'll probably wait there for someone else to come evaluate him there to decide where to go from there.
Okay.
Sometimes they treat it with antibiotics.
Okay.
Watch and wait. So that part is. I'm not sure of what exactly will happen. So, but kind of the avenues that it might go: surgery, maybe watch and wait with antibiotics, depending on if he's had fevers, if he has a high white blood cell count,
Right.
some of these other things. So, if they've taken blood, they'll look at all these things and they'll kind of come up with a decision based on that.
Okay.
Does that make sense?
Yeah. So I guess how soon should I expect him to be able to go? I mean, is this something that's going to be over the next hour? He's going to go right in, or?
I mean, once again, not having seen him. I mean, if he's fairly stable and doing okay, then they may wait. It just all depends. Once again, the sooner we get you back over to the emergency room, the sooner the pediatric radiologist can come take a look at him and tell you what their plan would be.
Okay.
Whereas to how quickly they would go to surgery. I mean, that's typically the most common thing that happens.
Okay.
Sometimes there are things we see on imaging that make us more concerned.
Right.
Like if we see fluid around the appendix, that might mean that it's possibly ruptured.
Okay.
I didn't see that.
Okay.
So it may be less of a concern to rush him, but once again, that's gonna be totally up to the surgeons that evaluate him and see.
Okay. Do you know what the risks are, or anything with it? Is this like a common procedure?
I mean, once again, that will be more up to the surgeons to kind of give you the
Okay.
detailed risks
Okay.
involved with surgery. You know, the thing I can say is that kids have appendicitis quite frequently
Okay.
and undergo surgery successfully.
Okay.
So, I mean, it's not something that's rare.
Okay.
We'll say that.
That's good to know.
And so, but the fact that you have a pediatric surgeon involved, they're very good at what they do.
Okay.
You know, that's a specific subspecialized group of doctors who have trained specifically to have, you know, to treat children
Okay.
and do surgery. So once again, it's very common. It happens quite a lot, and,
Okay.
and it's not something rare that you would have to worry about, oh, this is so rare, what are the outcomes, and they don't even know.
Okay.
They'll be able to give you probably statistics and percentages and all kinds of
Okay.
things, but the main thing I can tell you from my knowledge is that it's very common, and surgery is usually the treatment, and that things, you know, calm down. I mean, there are complications with anything, as you know.
Right. Right.
So I don't want to give you,
Right.
you know, hope that it will be perfect, but,
Right. Right.
you know, I just know that it's very common.
Okay.
Okay?
Okay.
What else?
I mean, I'm sure I'll think of questions after you leave, but I think, you know, I'm just still caught off guard, so I haven't thought of all the questions yet.
Yeah, that's,
But no, I think that's it for now that I can think of.
yeah, that's quite a jolt to go from let's go home to maybe we're going to surgery.
Exactly. So I just don't know why they would say that, and they wouldn't tell me beforehand that they were looking for that in the ultrasound. Because I mean, you came in here and you were like, "This is what they were looking for," which is great. would have much rather have you come in here earlier.
Yeah, well,
than
once
the person
again-
that came in before you.
Once again, I think that, you know, if he wasn't in that bad of pain, or
Yeah.
his exam wasn't very concerning, they're like, you
Right.
know what, I'm not that concerned, but let's just make sure.
Yeah.
So they maybe didn't think it was appendicitis, and
Right.
then we happened to see it. So
2 minutes remaining.
I think it's one of those things where they just felt like, he's probably okay, but let's get it just in case, and then
Right.
they may be surprised like you are.
Yeah. Right.
That we're seeing the appendix. And once again, that may be why the surgeons
Right.
choose to kind of watch and wait and see.
Okay.
But the main thing is to let you know what we see and what that
Thank you.
may mean. It doesn't mean he's going straight to surgery,
Okay.
but that could be a path that he takes to get better.
Okay.
All right, does that make
Okay.
sense?
Yeah, no, it does. Thank you very much for
Yeah.
being honest with me and letting
Sure.
me know what's happening.
Yeah. What else? Anything else before I take off?
No, I think that's it.
Okay, so I will go let the technologist know that we're done speaking, and we'll get you back over to the emergency department. If you
Okay.
think of anything now or even later, have questions about the imaging, I'm happy to answer any questions you might
Okay.
have.
All right.
Okay?
Thank you so much.
Nice meeting you.
You too. Thank
Good
you.
luck, Colin.
Thanks.